So for women who did not have children before, so if they had an implant before, is it okay to breastfeed? Does it have any problem?
Yeah, that's a very commonly asked question.
And the facelift, it is a permanent solution? No, right?
No,
After
because
certain
aging,
years, again, that gravity will pull down
correct.
the skin. So when you have the fat grafting, is it also part of facelift?
Yes. It is a part of facelift because rightly said, it's
to enhance the cheekbones, right?
Because the volume is lost, right?
Right. And the next question is for Botox, which is again a very predominant topic and also my favorite topic.
So Botox is a neuromodulator, right? It's derived from a bacteria.
Right. It relaxes the muscle.
It relaxes the muscles.
What are the targeted areas for Botox?
Most commonly, patients come to us for the forehead and the crow's feet. Right? These are the ones that you get on your smile.
Right. Hi everyone, I'm Pallavi. I'm a lifestyle and corporate influencer, and today I have the privilege to have Dr. Mayur Shetty with me, who is the consultant plastic surgery at Manipal Hospital's Old Airport Road. Thank you, doctor, for joining me.
Thank you.
And we are having an interesting discussion today on plastic surgery, which is, I think, a very hyped up and for a very correct reason across social media and elsewhere. So we have a lot of topics to discuss, but I have picked up 3 topics to be brief about it. The first one is about breast augmentation. So whom do you think are the correct people to opt for this procedure? Is it just the aesthetic sense, or is it some other reason, functional reason or something?
Yeah, so this is a very good question because breast augmentation is something that can be from a wide variety of patients. It can be either even teenagers who have a small breast and they have something called as tuberous breast deformity.
Okay.
So basically wherein the volume of the breast is very less. And can even range up to people who have just finished their pregnancies and they have a volume change because of the breastfeeding and everything, and who want their breasts to be probably enhanced, and even age related wherein the volume comes down and there is some sagging of the breast to some extent. So these are all the candidates who can undergo a breast augmentation.
Okay. So breast lifting is different and breast augmentation is a separate thing, right?
Yes.
So you need breast implants for the breast augmentation.
Yes.
So what are the different kinds of implants that Manipal is providing? And how are you different from the other places that are providing?
Correct. So at Manipal, we use only the standard FDA approved implants.
Okay.
These are either German or French made implants. Most of the implants that we use most of the times are going to be silicone implants. There are also saline implants which are used, but silicone is the one that gives a natural texture and feel to it. So we use silicone implants that are have a certain texture to it, which is called as nano textured implants. These implants cause the least amount of complications and have a more longer lifespan.
Longevity.
Yeah.
So it doesn't rupture easily.
It doesn't rupture, it doesn't cause any kind of capsule formation. The reaction of the body is lesser, so the patient does not develop any kind of symptoms even over a long time. So usually an implant can be kept in the breast for a period of about 15 years, during which we do examine them and check whether it's fine.
The capsule formation that you mentioned.
We do it at regular intervals.
Okay. How do you check it? What is the procedure of checking?
Most of the breast implant patients are asked to have a scan done every 5 years, or even before that if they develop any symptoms to it. But in our practice, we have seen that most of the patients with the implants that we use go symptomless for a period of about 15 years, after which we ourselves ask them whether they want to get it changed. And it depends on the patient's symptoms.
And aesthetically and anatomically also, do you suggest them what is the correct size for them?
Correct, yeah. So most patients require that education wherein based on the size of their chest, the size of the breast itself, it's called the foot plate of the breast, we decide what kind of implant is better for them. A lot of them will have something in their mind that we want this much of increase. It usually goes according to the cup size of the bra, but we usually advise them based on our knowledge of the anatomy and the patient's anatomy. Each patient's anatomy is going to be a little different, their skin will be a little different. Based on that, we advise them what implant they can use and which is the best for them.
And how invasive is the surgery?
Breast augmentation as such is a very, very simple procedure. It is a surgery, but it takes about 2 hours to 3 hours to do.
Okay, it's under general anesthesia.
It's under general anesthesia. The patient can go home the same day or the next day. Resume activities immediately the same day, which includes even stretching their hands over their head without any problems, because the kind of technique we use is a very small incision and we use an implant funnel So we don't touch the implants at all.
Okay.
So through the funnel, we're able to put in any size of an implant. We also
is it behind the pectoral muscle that it is placed?
Yeah, so that's a good question. That's based on the breast. It's as such. We decide whether it's behind the muscle or whether it's above the muscle.
Or you can even put it above?
You can put it above the muscle, just behind the breast gland. So that's another plane. It's called subglandular plane.
Okay.
This is based on the patient's build, right?
Okay.
So if it's
So what is the deciding factor?
Yeah. So multiple factors. Lot of bodybuilders come to us who have loss of breast volume.
Right.
We can't put that under the muscle
Oh.
because there is a chance that when they're working out and they're
might
bulking
rupture.
up, it may rupture. So for them, they would
Because the
require
muscle is strong and when it contracts, it might affect
yes, it may affect, it may displace and all that. Because these are people with very good builds.
Right.
While there are some patients who also have good amount of breast tissue on the upper part of the breast. Based on a lot of these factors, we decide that okay, we'll go for something that's below the gland, or no, we'll decide to go below the muscle.
Got it.
We don't go with the single mind on these.
Right. Like you said, one of the major concerns is like breast sagging after breastfeeding. You said
Yes,
that is the
yes.
reason.
Yeah.
So for women who did not have children before, so if they had an implant before, is it okay to breastfeed? Does it have any problem?
Yeah, that's a very commonly asked question. Whatever we do is we incise on the skin, but we don't touch the breast gland at all. We go completely below it without even affecting the sensation, the nerves and the blood supply of the breast. So the sensation of the breast also remains intact.
Okay.
The planes created are in such a way that we don't touch the breast architecture at all. So if it's below the muscle, it's definitely free. Even if it's below the gland, we make sure we keep a layer below it and then only put our implant. So even a person who has not planned a family yet, not married yet, it's a very safe procedure.
Right. So I think you've answered most of the question related to this. Now I want to discuss about facelift, which is also a very common procedure these days.
That's true.
So what are the different techniques and what parts on the face do you target when you are operating?
Facelift. Yeah. So facelift is basically you can lift any part of the face. So there can be the upper face, the mid face, or the lower face.
Okay.
In all these procedures, we are basically reversing the
Age.
sagging, the age-related sagging of the skin, volume loss. So whenever we do a facelift on a patient who's coming to us, probably in their 50s or 60s, it's usually all parts of the face. So we can lift the brow up, we can lift the cheek up, as well as we can lift the lower
Jawline.
face and give the jawline and the neck. Because whenever, as we age, we develop the the double chin and we develop that web there. So that all that can be tightened to get back the jawline and everything.
Is it a surgery or is it like the thread lifting when you say facelift?
Thread lift is a non-surgical one. There is only some amount that you can achieve. So if it is a younger patient who just wants to change something slightly, we advise them a thread lift, which is minimally invasive. And we just go put these threads in, we lift it in the direction we want to.
And the threads are made of collagen?
Yeah, so they stimulate collagen. They're usually made of silicone.
Okay.
And
so they
these
dissolve
threads-
inside the face?
Yeah, there are two types. One is permanent and one is one that dissolves. Permanent ones we don't prefer, while the ones that dissolve are usually silicone ones, which also lift up the face and also dissolve over time. Plus they stimulate collagen, so they improve the skin and everything.
Got it.
So these are all temporary.
So like 1.5 2 years?
Yeah,
that-
probably 1.5 2 years.
Right. And the facelift, it is a permanent solution? No, right?
No,
After
because
certain
aging,
years, again the gravity will pull down
correct.
the skin. So for
Aging-
how long does it stay?
So usually about 15 years.
Oh, that's a good time.
Yeah, 15 years is a good time because you don't have to keep trying to get touch-ups and everything.
So what are the
after that.
surgeries that are
Yeah,
that goes?
so in a facelift we do something called a brow lift. We
Okay.
go from within the hairline
Okay.
and we anchor
So
the brow
skin
up.
is
Yeah,
pulled?
not only the skin but even the muscle that
Okay.
actually sags down,
Okay.
we lift it up.
Okay.
Similarly, the mid face, we go from an incision that's not visible, and it actually works out very well for the patient because within the ear line itself.
Okay.
And we lift up the cheeks, where also people develop these very deep nasolabial folds, which completely goes.
Right.
And then for the neck, it's from behind the ear. Usually these procedures are done together,
Right.
but it depends on which part the patient is actually having a problem with.
So when you have the fat grafting,
Yeah.
is it also part of facelift?
Yes. It is a part of facelift because rightly said, it's
To enhance the cheekbones, right?
Because the volume is lost, right?
Right.
As we age, we get hollows. So we also put in fat because that fat has atrophied over time. So along with the facelift, we do put in fat.
So
The
from
patient's
which
own
part
fat.
of the body you generally retrieve that?
I prefer taking it from the thighs and the abdomen. because this is the area which has the maximum stem cells according to a lot of research.
Okay.
So we prefer to take it from there. It lasts also for a longer time. Fat is always permanent. It grows with your body. It gets blood supply and everything.
Right.
These two areas are where the maximum stem cells are available.
And alternatively, if somebody wants the buccal fat removal, it is not for the older patients, right?
Yeah, so it does benefit some older patients when they have a sagging and the fat is all completely here.
Okay.
So based on when we do the facelift, we see whether the buccal fat is going to change something, then we remove it. But usually we do it even for patients who have a little chubby cheek, lower face. They want that, something called the OG curve.
Right.
To get that, we remove that buccal fat over there.
Got it. And how long does it take, this surgery? Suppose it's a full face rejuvenation, like you mentioned, most of the patients, they want the complete facelift.
Yes.
How much time it takes?
It's a procedure about 4 to 5 hours.
Okay. Under general anesthesia?
That's right. It's under general anesthesia. We prefer to keep the patient in the hospital for a day, and there will be a small drain which will be removed on the day before the discharge itself.
Okay.
And since we have a good team here and a big team here, we're able to do these procedures very quickly. We work together, and that way the patient's operative time comes down, the chances of complications. So here we use a different technique. We use some hemostatic agents, which prevents complications like bruising and all that over the long run.
Right.
So that way it makes it very safe for the patient.
And how long it takes for the face to completely heal? Like you said, bruises. There will be a minimal bruising.
Definitely.
When will it go and they can come out for the social life outside?
Yeah. That's a good question. So any face surgery takes about 7 days for the swelling. It suddenly rises up and then it dips down. So I would say if you're planning it, it should always be give a period of 2 weeks and a period of 1 month before you have any social commitments.
That's pretty small time, 1 month.
It is a small time, yeah.
Got it. I think that was for the facelift, and the next question is for Botox, which is again a very predominant topic and also my favorite topic. So what are the different Botox that you have? Is it like, I know for for fillers, dermal fillers, there are various kind of fillers. For Botox, do you have different kind of Botox?
Yeah. So we have different kinds of Botox based on how it is prepared. So Botox is a neuromodulator, right? It's derived from a bacteria.
Right. It relaxes the muscle.
It relaxes the muscle. So it somewhat paralyzes it, but based on how much you give it, it does only a slight amount of paralysis. So based on the longevity of action, we have Botox, which is our normal Botox that's available to us, as well as something called as Dysport, which lasts for a longer duration and probably a quicker action. So based on that, we have different types. There are a lot of types of Botox available, but these are the ones that are standardized and FDA approved companies which we use, and there's a lot of safety that we believe in, so we use these two types of Botox.
What are the targeted areas for Botox?
Most commonly, these patients come to us for the forehead and the crow's feet. Right? These are the ones that you get on your smile.
Right.
And the second most common is the neck. What we do is something called as the Nefertiti lift, wherein we inject the Botox along the neck lines that form, and this also along the jawline. So what happens is the jawline gets defined, and the neck also, all your bands disappear.
Okay. And I also heard somewhere instead of lip fillers, few people use little Botox for the lip lifting on the upper lips, on the cupid's bow.
Yeah. It does happen because what happens is some people have a very thin upper lip because of overactivity of some part of the muscle around the mouth. So if you weaken the part that's overactive, the lip automatically lifts up. But usually it's a combination of techniques like using a Botox and a filler. And it's very important to know the anatomy of that area very well. So as plastic surgeons, we do facelifts. We see this day in and day out. So we know exactly where these muscles are, what part of the muscle is how deep, and we know where to inject.
Right. So this is the cosmetic procedure, but as we know, it's also used for functional use, like for muscle spasms.
Yes.
What is the what kind of patients come to you for that, and how do you?
That's a good question. Most of the patients who have these traumatic, road traffic accidents have some, nerve palsies, which means that they're not able to move certain group of muscles. So if I'm not able to move this muscle, my other muscle that straightens out my elbow becomes more active.
Right.
So in that, and this is just an example.
Right.
So to weaken that extra activity of that muscle
to balance it out,
we give Botox. The other thing is we give Botox for people who sweat a lot. In the axilla and in the palms, it's called hyperhidrosis.
Okay.
So we use Botox to help them with that because that's quite a tough problem, social problem,
embarrassing social problem.
situation. A lot of sometimes the bad body odor because of the sweat. This helps a lot. Botox.
It helps in bad body odor.
Yeah, because
as well.
you're decreasing the sweat, you're decreasing the bacteria that form because of that, and then the smell comes down.
For how long does the effect stay?
Yeah, so Botox, according to the companies, the Botox effects they say it lasts for about a year and more. But in our experience, we know that it lasts about 6 months. But there is an additive effects of remnant effect of Botox that stays. So the next time you need to inject a little lesser. So it's a very good, chemical product to use.
Right.
6 months based on the area. If it's the lip, we use it a lot, so it's lesser. If it's the forehead, it's probably lesser. You don't use it much. So it's a longer duration.
Right. So they cannot be used for chiseling the, the cheeks.
Yeah, the cheeks and everything. Yeah, you can use
Botox.
It's always a combination.
Okay.
So if you feel that there's a bulkiness of the muscle here, or which is causing that bone to not be visible, same thing with the jawline. Because the muscle is, the neck muscles are too active, and that's causing the jawline to look like an angle.
Right.
When you want that actual cut here, then you can just weaken it a bit at certain areas, which we analyze. We always do an analysis. We mark those points out. We discuss with the patient that this is how you look. This is where it's more. When you do that and balance it out, then you will have a definition of the face.
True. And how do you modulate how much amount of Botox? Because recently there are many OTT platforms. There has been a few series that has come out, and people will be saying that if you're injecting too much of Botox, you cannot give expressions.
That's true.
So I think that is also some social stigma that many people who want to get Botox, they don't know exactly how much and whom to trust.
Yeah.
So how in Manipal you are regulating how much amount you should take so that your facial expressions are not impacted too much. Of course, it will be a little bit, but not too much. So that you can, go socially, you will not feel awkward.
Yeah. This is a good question. You see so many of the celebrities who have that plastic face. So what makes us different is, first of all, we, like I told you, we operate on these layers of the face so much, whether it's reconstructive or facial paralysis. We know these layers so well. We know which muscle comes where, how deep is it from the skin, what part of the face is affected. So we ask the patient what their problem is. We ask them to animate. Then we show them the mirror, we discuss it with them. And then we always tell them that we will do this much now because we don't want to overdo. And then once the Botox effects takes about 1 week to happen, and we hit the muscles which we only think that are actually need to be injected, and that makes us different from other injectors because of the knowledge of our anatomy. And after 1 week, when they come back, if they say that yes, I think we need a little bit more, we can always give it. So we don't overdo it.
So can you dissolve it? Like for fillers, you can dissolve it, right? If you don't like it, you can dissolve it. For Botox, can you do the same?
Botox is not easy to dissolve. You have to wait for it to wear.
So you have to initially start with a low dose.
Yes,
and
always.
If you want something else, then after a week or so you can.
Yes. It's always like that, and it's always good for the patient. And I don't think patients mind coming back after a week if the results are going to be great.
Right. So it's a very minimally invasive thing, and there is no downtime, right, for Botox?
Botox doesn't have downtime.
Right.
It's very important, that's why, to go slow. And once we know the patient keeps coming back to us. We know how the patient's
But you cannot apply makeup or any skincare products, right?
That's very true. You should not massage for the first 48 hours. You should not apply any skin products. It's very important for the patient also to not let that Botox displace anywhere else.
True.
So those are the instructions.
So for how long you have to be mindful? Even the laser facials that we do, suppose a Medlight C6 laser, that also you have to refrain for some time, right?
That's true, because there is some, in the lasers you have some amount of damage, controlled damage done to the skin. We don't want to change that, including the sun exposure and everything.
True.
So that's why we always wait till that new skin is coming in. Similarly for Botox, we don't want to massage that Botox into some other area.
Right.
So we want it to act there. So it takes about 1 week. When it starts acting, it's fine. Then you can go back.
So at least for after a month, we can.
I think a week to 2 weeks is good enough. You can
then it will not move around. If somebody is getting a facial massage, it won't move.
Yeah, Botox is a very friendly lunch hour procedure. You can come in between your office
work shift,
timings,
get it done and go. So there are no major side effects for it also, right?
No, unless it's overdone. It has to be done in the right amount.
Right. Thank you so much, Doctor,
Thank you
for answering all the questions.
Thanks.
And do you want to say something to the viewers for today's launch that happened?
Yeah, so we have made a very exclusive aesthetic studio in our hospital, so that patients coming for aesthetic services get a good amount of exposure that these services are available with us. Plus, they have the confidentiality that they need. They feel safe to come and do these procedures. And we're all experts in aesthetic surgeries, and we want to make sure that the patients coming for aesthetic services get what they deserve. And we are here to only deliver good results. So
I think this is a game changer for Manipal to start something specifically aesthetic and plastic. And
very true. It's a one of a kind, not started by most of the hospital branches because it's tough to segregate patients. But and we want to remove the fear of patients of coming into a hospital. This is the safest environment that you can get any procedure done.
It addresses also the stigma that I said about Botox and all other things. Like when Manipal is tagged, I think people will be very assured that they are in the right place.
Yeah,
because after all, even if it is a surgery, it is done on the face. So they are very cautious about that.
Very true, very true.
Thank you so much, doctor.
Thank you.
It was lovely meeting.
Thank you.